Not there. Okay, I'll start. I'll start. She says you start. Okay, I'll start. Okay, no problem, Suchi. I'm just taking it from here. So first, if you can go to the, if you can make it full screen and we can go to the first slide. Or we can just go to the next slide. Yeah. What you see up here, these are just some words. Power, patriarchy, beneficiaries, colonization, leadership. I'm just going to throw these words up at you and take a minute to just think about what this does in the context of young people, in the context of young people's voices. Uh, do we readily place power in the hands of young people? What are we doing about patriarchy? Who are the beneficiaries in a program, within a program? How do we decide who's going to be a beneficiary? Uh, who has the information? Who has the knowledge? Who has the power? And what is true leadership? So if you think about these terms, these words individually, what I'm trying to get at is, finding a way where we are able to reconcile and chart out a trajectory whereby we place power and leadership truly in the hands of young people. That is what we are trying to do. We are trying to place power and leadership in the hands of young people in a way that evidence can be generated directly by them. Research can be decolonized. It can be owned up by people who rightly need to take those decisions for themselves. That's the ask, big ask. Next slide. Consultations. So a lot of us, we attend different conferences, seminars. Consultation is a process of, discussions, a lot of brainstorming, trying to arrive at something. But how are we doing these consultations? I mean, here we are also at a consultative space right now. We've spent the last 2 days and today we are on at day 3 and we are experiencing a consultative process. But where are we going wrong with consultations? The broader narrative around decolonizing evidence requires respect, responsibility, and humility. Are we actually asking the right questions to the right people? Are we actually giving young people a place in the room? Are we bringing them? Are we inviting them? And if yes, how we are doing that? So who is benefiting? What's the agenda? Whom are we working for? Who is the other in this process? And who defines the how? And who is truly leading? So for us, who is truly leading is the big question. Who is leading all these processes? The benefit, who's benefiting, who's setting the agenda, so everything. So through the feminist consultation methodology, and when I come to it, you will learn, you will get to know how we are actually placing the agenda, the decision making, the process, everything in the hands of young people. Next slide, please. So there's a need for gender equality and young women's empowerment. And at the World YWCA, we believed we wanted to set, a bold agenda. And that agenda is globally 388 million young women and girls will be living in extreme poverty. So these are some of the pointers that led us to setting that agenda. An estimated 736 million, almost 1 in 3, have been subjected to physical or sexual intimate partner violence, non-partner violence, both at least once in their lifetime. Staggering figures there. Women make up only 5.9% of elected heads of state, 6.7% heads of government. Sorry, is Suchi coming in? Yeah, I see.
Yeah, I'm here. Can you hear me?
Suchi. Lovely, good to hear you.
Yeah,
Let me finish
hi.
the slide and maybe you can
Yes,
take it on
yes,
from there.
yes, please go ahead.
So these are some staggering figures, and this is what led us to what we have done as a part of, our World YWCA's Goal 2035. Suchi, you can take it ahead from there.
Great. So thanks, Vijita, for covering up. There was some technology glitch. I'm happy to be here now. I'm Dr. Suchi Gaur. I work with World YWCA as the Director for Global Engagement and Impact. We are thrilled to be here, sharing a bit more about the work we have done under our feminist consultation methodology. So, like Vijita mentioned, I mean, the work we're trying to do around gender equality is massively under-resourced and extensively in need of resources, in need of funding, in need of work and partnerships and cooperation together. And at the same time, in need of decolonizing the way that we have been working as a civil society sector or as government spaces around the world, looking at people as beneficiaries while they should be looked at and they should be the ones driving initiatives. So, if you look at the work that World YWCA does, we are constantly advocating for more young women and women leaders in the spaces, in governments, in heads of states, as those sitting in decision making platforms, trying to make an impact. And while we do that, we continue to advocate for feminist practices that ensure that all of us are moving together towards gender equality. Next slide, please. A little bit more about what we do as World YWCA. We are one of the oldest feminist movements in the world. We are a faith based movement, and we have been working since more than 150 years to advance the goals around gender equality in communities, in most marginalized communities around the world. Women and young women are the who are from these communities are the front facing leaders for our movement. And together in 2015, the movement decided that by 2035, our goal was to reach 100 million young women and girls and make sure that they are equipped with tools, technology, with resources, with the confidence, and with the spaces to transform power structures, to create a more gender equal world. Our goal 2035 is very directly linked to the UN Sustainable Development Goals, as well as to the our common agenda that is from our General Assembly right now, that was adopted last year. Next slide, please. And World YWCA, how do we do this work? We believe in making sure that our engagement drives change by connecting and mobilizing leaders on the ground. We believe in purpose driven, authentic investment in leadership work, in making sure that those who are truly the closest to the issues are the one leading the issues, are the one experts seen as experts on those issues. Um, there is massive work that needs to happen around strategic collaboration, that we are trying to do and ensure as a feminist space, to make sure that organizations, movement, youth spaces around the world partner in a more meaningful way, not trying to replicate each other's work, but trying to cohesively work together. And that's where we bring in our unique expertise of bringing in the practices that are key to gender equality work. Last year, World YWCA was proud to sign one of the Commonwealth MOU in Kigali, in Rwanda, at the Commonwealth meeting, and which emphasizes on the leadership of young people around the world. Next slide, please. So when we talk about feminist consultations, and going back to what Bijita just mentioned, what is it? When we look at these terms, when we look at beneficiaries, when we look at power, when we look at evidence, we believe that there is a lot of work that still needs to be done in making sure that people who are truly representative of that data, of that evidence, are the ones leading and driving that evidence. And very often we have seen that this requires a lot, this work, there is a lot of power imbalance that exists between humans when we talk about consultations. Who's a researcher, who's the one being researched, what's the power dynamic between them? There is very little space for co-creation and co-ownership of the information. You know, our experience has showcased, and I'm sure all of you sitting in the room believe that the experience has showcased that when we are trying to make sure the community is the center of the thing, of the process, they are generally engaged only in bits and pieces, either as, oh, you have to fill this survey, or we are going to listen to you, or you will come at the design stage, not at the implementation stage, or you're just going to be an implementation piece for us, not the ones truly driving the processes, which is what happens at the end is that they engage in consultations or they engage in evidence building, but they don't own up the evidence that comes out of it. They don't even, maximum of the times, they don't even know how they can benefit from the evidence or what is the evidence in itself. So, there is value in putting the experiences of communities at the center of the design of the consultations in a way that they drive those processes. And our roles as CSOs, as governments, as organization becomes those of facilitators and not the one driving processes. Next slide, please. So for us, when we talk about what's the feminist way of doing things, then very often we hear this thing, oh, you are a women's rights organization, feminist movement means, feminist work means only centering women, and that's not true. And we all know that feminist work and feminist evidence generation calls for more equal opportunities, equal spaces. That includes making sure those who are underrepresented, those who are often marginalized from the processes, they are given equal opportunities as everyone else. In our case, obviously, when we talk about locally led, we talk about women and young women at the center of design, planning, implementing, owning any kind of data that is coming out from the ground. If it is as simple as, hey, we want to design a campaign, the women and young women, they work together to design that campaign from those communities. They design it, they plan it, they implement it, they own what happens out of it, which helps them advocate for better policies when they are sitting in spaces. They're not just going in these policy spaces on policy tables, on policy dialogues as experience sharing tools. I'm going to go there. I have to talk about my story. No, they are going to back up that information with evidence that's coming from ground. And that's what feminist values piece comes with. There is focus on safety, there's focus on consent, there is focus on language, there is focus on power sharing rather than power creating. There is focus on breaking through the traditional intergenerational pieces that happen within different generations and different age groups and different genders. With feminist evidence generation, there is also a whole process on emphasis on community consent that comes in. What are the issues, how do we want to frame them, what are the words that we want to use, are these words truly representative of our community, how do we write it in a way that the person who's responding, the person from my community who's responding, how do we question the frame the question in a way that the person doesn't feel disempowered, the person doesn't feel that they are sitting on the periphery, that they are not engaged, that they're not being respected. Feminist values talk a lot about respect, about consent, about community engagement, about community being a part of driving the processes, especially when it comes to issues around reproductive rights, sexual health, mental health, conflict, gender based violence. We know that sexual and gender based issues, all these require key work around sensitivities and making community aware about it, and not just like asking a blank question. A very good example is that very often when we talk to young women, that do you consider yourself from one of these marginalized communities? They know they are part of it, but they don't want to say yes because they don't want to feel segmented out. And very often we know when we see responses, if in a general survey you will see they have responded no, but they actually are from the community. How do we frame these questions in a way that they do not feel disempowered to respond in their most honest self? And that kind of how only happens when we engage these community members in framing the very questions that they're going to be asked. There's a long term benefit around co creation, and we believe there is a lot of long term benefit around co creation because it helps in building leadership of community members. It helps in making evidence building not a third party kind of a process, but a process that helps them make these issues closer to their reality. Make sure that when they are talking about changing these realities, that they truly own the processes and evidence, that when it comes to a research being done and research finished, it's not just gone, it's sustainable. It kind of feeds in into the community development piece. So we see feminist evidence generation as a more sustainable, long term, kind of constantly benefiting the community kind of a model. And we think it's very, very critical that we approach our any research or any evidence work that happens within communities with that lens. Next slide, please. And that's where we started conceptualizing our feminist consultation methodology. So in 2018, World YWCA had gathered enough evidence from communities, from women, from young women, where they were saying we are just being seen as beneficiaries, we are just being seen as tick marks, we are just being asked questions and never told where that evidence went into. And we realized that what was happening was traditional research methodologies, which were rooted in colonial approaches, were kind of dismissing their realities, were kind of dismissing their leadership and what they can do with that evidence, were also not democratic in the way that they should be, and were not centering their identities in the truest manner. And that is why we ventured in 2018 on a whole approach to work with women and young women in communities to design this feminist consultation methodology. And we launched it last year. It took us 3 years because it was a highly consultative, facilitated process with various group of women, young women from around the world. And it was beta tested a number of times to make sure that the methodology is academically robust, is all the biases are considered, and that what we are going to share with the world is actually an evidence-based process. We realized that during this process, that when we were beta testing, that the usage of the methodology was not just to collect evidence, but might help women in general, women, youth, young women, or other marginalized communities or underrepresented groups in shaping their own leadership within looking at evidence. I have We have some beautiful examples where after going through the feminist consultation methodology, people have come to us and said, I have realized I can question any data now. I can look at things and say how, and question how was this generated? Is this truly represented? What were the questions asked? Was community considered? Was this data fed back into the community? And that's helping in the leadership skills of young people who are working through these processes. uh, our methodology, when we launched it last year, it was already beta tested with more than 1,000 women and young women. It was also used for an evaluation of a multi-year grant work with government of Finland. Next slide, please. So currently, how we have used our feminist consultations methodology for youth is a very exciting approach. So back, can you go back? Yeah, thank you. So the Global Youth Mobilization is a big initiative of youth organizations, six big youth organizations around the world. We call ourselves Big Six Youth Serving Organizations. And World YWCA is a part of it. The other organizations on the list are World Scouts Movement, International Federation for Red Cross and Red Societies, International Duke Award of Duke of Edinburgh, YMCA, and Girls Guide. And World YWCA is one of the six organizations. And what we have done recently is we have used this feminist consultation methodology to define the thematic focus of the next multi-million dollar investment grant that we have written together with young people. Young people have worked together to co-design a whole funding, multi-million dollar funding grant and investment that we are now approaching organizations with. And it used the methodology in the truest way. Young people came together to as a co-design lab and designed what that grant will look like, envisioning what young people from around the world want, consulting young people from around the world through surveys, through interviews, through facilitated conversations and dialogues, truly representing in that proposal, in that funding proposal, what young people want. World YWCA has also is working on an intergenerational leadership tool that is using methodology as well to generate evidence for making sure that the tool in itself is is uh, is full of feminist consultation processes as evidence to what intergenerational leadership would look like. The methodology, as I mentioned, was used for evaluation of a 3-year funded initiative on reproductive rights in Asia, Africa, and Eastern Europe. And we have also used the methodology to develop a leadership curriculum with young women. Um, Today, what we will be focusing on are two of the four researches that we conducted or we commissioned as Worldwide WCA with groups in India, Nepal, Thailand, and Bangladesh, um, which engaged more than 800 women and young women in Asia on variety of issues. So today we'll be talking a little bit more about those case studies and sharing examples from two countries, one of Bangladesh in the Rohingya community and the second from India. Next slide, please. Just a little bit more about the methodology. It's a next slide. Can you shift the next slide? A little bit more about the methodology. We are it's a very simple, it's a typical research methodology. Sorry, can you hear me? Next slide, please.
Oh, no, the previous slide, sorry. It has to be the previous, yeah, the 6 steps.
Six steps, yeah. 6 steps. We can't see it, Bijita.
You can't see the 6 steps?
No, it's the screen is frozen.
Okay. Could
It's
you just
still
talk
on
about
pause.
it? Okay.
Yeah, I can still talk about it.
Yeah.
So it's a 6-step process which focuses on basic 3 steps around planning, implementing, ideating, implementing, but then adds a lot of steps and focus around learning, iterating, and redrafting what analysis, iterating, learning around what the next steps should be. So the use of the methodology in any research doesn't stop at we have done this evidence, this is the report, this is the analysis, this is what we do with it. It goes to the next level of how it can drive community action, how we can circle back it with the community to kind of push for more changes. How can we get further funding to do more innovative work around it? So there is a lot of that push that comes around the 6 steps of planning, designing, and implementing, and sense making, learning, and iterating. And the methodology is designed in a very user friendly manner. If you look at the tool, it is a human centered design tool which has a lot of learnings. There are 100 pages of annexures we have provided, which can help any community member use the tool in a truly engaging manner to work with community members to generate evidence. In one of our recent work with Accountable Now, this tool
Right.
has been mentioned as one of the key locally led tools, which helps in driving local led processes, accountability, and transparency in research. So we are very happy with how organizations are looking at the tool and kind of seeing how the process is disrupting the typical way evidence generation is done. Vijita, we can still see the feminist consultation slide, but I'm going to keep on going to the next step. I'm
Yeah.
hoping people in the room can still see.
Yes, yes. We have moved to the next one.
Okay, so as we mentioned today in the four feminist researches in Asia, we are talking about. We will be mentioning two of those in detail.
We have about
And
5 minutes left, though. Okay. Suji, we just
yeah.
have 5 minutes left.
Yes. So Vijita, maybe you take over from
Yeah.
the Global Action Researchers place. Yeah.
Yes, yes. Thank you, Suji. Thank you so much. And I'll just add one more line to what Suchi was saying, and since she ended with how we are trying to disrupt how research is typically done. If you remember on the opening plenary, Professor Sala, he talked about the pedagogy of disruption. And I was wondering and just thinking about how beautifully FCM connects, relates to that pedagogy. It is fundamentally trying to disrupt the way evidence generation is being done, and it is placing that power in the hands of young people. Now, with that, as Suchi was mentioning, that we commissioned 4 researches based on the FCM methodology last year, and two, four very unique different contexts. And I'll be sharing two. One is in the Rohingya community in Bangladesh, a study done by Maya School, this organization called Maya School. They are based out of Cox's Bazar, which is a region inhabited by Rohingya camps. They are settled there. So this was a research on to deep dive on healthcare access for adolescent girls and by adolescent girls. The second one that I'll be talking about is in India. It's from India. The FCM is helping Feminist Munch. It's a cohort of young voices that was brought together, and they deep dived into youth feminist engagement issues and policies, and and then they prioritize some of the issues around gender equality to be then shared at the CSW 67. So they came up with a charter of demands that was then presented at and a plan of action that was presented at CSW 67. Next slide, please. I think I can, okay, a bit of background. Oh no, I've already talked about. Next slide. So the first case study, very quickly, and since there's less time, Maya School, the context, it was the research was kickstarted in November 2022, facilitated by a core team of 5 researchers, young people, and co-led by a youth advisory panel that was set up by them within the Cox's Bazar community where the Rohingyas are settled, aged 12 to 25 years. So it's a cohort, this youth advisory panel is a cohort of 10 young girls and women who are between this age group in the Rohingya camps, living in the Rohingya camps. The research topic that they researched on was healthcare access for adolescent girls in the Rohingya camps of Cox's Bazar, exploring lack of sensitivity towards Rohingya women in camp clinics, limited and unequal access to services, and lack of Rohingya women as service providers in clinics. Next, please. So how did they use or adapt it? As we believe, FCM is a very flexible, it can be easily adapted to different contexts. So through the 6 steps, how did they adapt FCM, or how did they use to fit their unique context? They started with reviewing the FCM, they defined their goals, and they set up the YAP, which was the Youth Advisory Council. So these, through open application, the young women were selected, they were brought on board. And then these young women, they came together to map out resources and budget. It wasn't a very big budget, let me tell you, very limited budget, but they have used that amount to the best, they've put it to the best possible use there can be for that money. They mapped out resources, they designed their own budget, they set up a timeline tracker through monthly meetings. All this is being done by young girls aged 12 to 25 years living in those camps. They created the design. They created field guides with focus on use of language. FCM focuses on language, on how you are using language. Is there the tone of respect? Is there the tone of equality, of equity, of bringing everybody together, accountability, transparency? So the language was very, very important. Intersectionality, respect, diversity. They also decided the data collection tools were also completely done by them. They explored the research methods, and FCM, if you look at the tool, it gives in very simple language again, not heavy jargon or big words, the way we use in scientific or other kind of research. It's been made very simple and easy to understand for young people to use. Surveys, FGDs, interviews, storytelling. Some of these tools were explored and used by them. Implementation, prior to implementation, the team practiced, as I said, these were very young girls. So they practiced the FGDs interviews through role plays. A total of 44 members of the Rohingya community were consulted through 7 FGDs at the end of it all. Next, please. Sense making. They themselves organized all the data through Excel sheets, coded the information, identifying broad trends. So, everything that we social scientists or researchers typically do was being done by these young women under the supervision of 2 young women researchers, feminist researchers. They grouped the key findings, they went back to the community for validating the information that they had collected, and they organized it under various themes and sub-themes. For learning, reflection as a research team was done to not just assess the impact this study has had on the community or the recommendations, but also the impact it has had on them to assess what this process that they went through, how has this impacted them. Challenges faced, key learnings, all of this was done through multiple team sessions. Plans right now, they are at the iterative stage. They are planning to disseminate the final findings to humanitarian actors, UN agencies, NGOs, and also share the key recommendations with Government of Bangladesh. I'll quickly go to the next slide to share some of the key findings. I've just picked three top ones. Severely lacking in culturally insensitive healthcare services in the camps. Owing to a combination of factors, data shows that adolescent girls largely avoid going to camp clinics, often leading to dire. And these are, you can see this is a FG, I think this is an interview in action. Going to the camp clinics to often leading to dire physical and mental consequences for adolescent girls. Feelings of shame, discomfort, stress reported with almost 100% respondents during the study, irrespective of age. No matter how old you are, if you're a girl, you're going to the camp clinic to access, you felt shame, discomfort, or stress of some kind or the other. Next slide, please. And these are the key recommendations made by these young girls, that there is need for community level trainings, awareness generation around these issues, training to community health workers on compassionate healthcare and being gender sensitive, less wait time, more prioritization of adolescent girls seeking care and services, community education sessions with men and boys, very, very critical for gender sensitive behavior and avoiding eve teasing, provision for safe spaces, women friendly doctors, physicians inside camp clinics. Next slide. So that was Maya School, and this is one. I'll quickly skip this. I'll go to the next case study, which is Feminist Munch from India. The context, again, led by two young feminist consultants based in India, 13 co-researchers from across India. And you can imagine India is a huge country. So there's one from each state. Ideally, they should have picked up, but time did not allow that. Process involved a deep dive into deepening young feminist engagement in policy advocacy spaces. Their theme was innovation and technological change and education in the digital age for achieving gender equality and the empowerment of all women and girls. So they focused on this also because this was the CSW 67 theme topic. Next slide.
I have 2 minutes, sir.
Okay. So I just want to focus on how Feminist Munch's approach was slightly difficult, radically difficult from what you saw Maya School use. So for them, the planning, scoping, onboarding was done through an open call application across India. Then after that, they explored methods of working collaboratively because you can imagine, this entire process was done virtually. While with the Rohingyas, they were there at the camp. They were physically present. This was a virtual engagement across different states, different actors, co-actors. So this was a bit challenging in a very different kind of setting. Then deepening, so they had to create a common agenda for advocacy and deep diving at the implementation stage, deepening participatory methods. Yeah, what I want to highlight here are the several grassroots consultations. So each actor from each of these locations, they did grassroots level consultations using FCM in their unique locations. And then all that information was brought together. Next, please. Sense making was done through analyzing all the 500 contributors, primarily young women, girls, gender diverse youth. All this information was analyzed, learning through reflective sessions, deep diving sessions, and iterate. We are still at that stage. And what I personally, we at Worldwide WC really feel proud about is that Feminist Munch, what started with this little experiment, they have said that they want to exist as a group. So it is a whole new entity, Feminist Munch, and they're going to work independently and continue this journey that they started with FCM. And that really makes us feel proud. Next, please. Their findings are digital technology focused, limited access to technology, digital spaces in rural communities, language barriers, lack of resources, marginalization of certain groups, including women, human rights defenders in rural communities. because a lot of information these days, what we want to share is curbed. It is not allowed to be shared. So these kind of issues were also being faced. Online digital harassment, targeting of women, these are the issues these young people have felt is going to be important, and you need to talk about these issues more. Limited government schemes and support for technology related initiatives, patriarchy functions, how that functions, you know, usage within families. And I know all of you are aware how if there is one phone in the house, probably the male person will be given the phone versus the female person. So, these kind of issues. The next slide, please. Conclude. Yes, I'm quickly going to finish now. So these are the recommendations made, and it's available online. You can actually look it up. They have their own charter of demands. Sorry?
Is it on YWCA?
World YWCA. No, it is actually part of a report that Feminist Munch has already published, and you can access it. I'll share it with you maybe after the presentation. Next, please. Okay, now this is my final slide, commonalities and learnings on FCM. So what we started out with, these 4 studies, I have only shared 2 case studies here, but all the 4 have given us so much hope that this method is actually flexible, adaptable within any context. If you want to place the power in the hands of youth, you can do that for evidence generation. There needs to be trust, there needs to be hope, but it cannot be common. It cannot be same across the board. So there are commonalities as well as variations in the way FCM can be adapted. The 6-step process can be used within unique contexts and adapted for better sense making. FCM can be applied in a democratic way with young co-researchers. It can be clubbed with leadership development, and we have actually used it in other contexts, and we are continuously using it for all our purposes. Thank you. Thank you, Suchi.
One burning question, sharp and focused. One, make it brief because the other presenter is waiting.
I just wanted to know whether your statistics are up to date.
Yes.
Because in one of the things, it's up to date.
Yeah. So there'll be opportunity for more questions during tea break.
Yes.
But we'll just move on to the next.
Sure.
Okay. So if you can bring Mr. Amilcar from the Ministry, the Prime Minister's Office of Trinidad and Tobago. So over to you, Mr. Amilcar. You can
Thank
hear
you
us.
very much. Yes, greetings. And I would need some assistance with the PowerPoint slide as well. I sent it as an email.
Yes, it's on the screen. It's being operated.
Yes, we're going to just share screen 1 second.
Yes.
Thank you. Continue. Perfecto. Thank you, Angel Fletcher, for the support and all members in the organizing team to facilitate this session here. This morning, I will look at contemporary gender and development issues in youth work, perspectives from the Trinidad and Tobago gender machinery. Next slide, please. Greetings all, my name is Amilcar Sanatan. I am the Assistant Director for Gender Affairs and Gender and Child Affairs in the Office of the Prime Minister in Trinidad and Tobago. Youth work is important to our division because young people either model positive or harmful gender practices. Youth are identified as a special interest group in the Trinidad and Tobago National Policy on Gender and Development, and we believe that this is essential to the society's move towards a more equal and just nation. Next slide. In solidarity with my Caribbean colleagues who presented earlier, I take time to honor the legacy of the pioneering visionary Dr. Henry Charles. Dr. Charles was a key figure and force in the Caribbean and Commonwealth youth development landscape. He occupied leadership spaces to include and create more spaces for young leaders in the region over decades. Dr. Charles ensured that gender was a key component of the national youth policy in Trinidad and Tobago. He made room for young voices promoting gender equality for all and we are deeply saddened by his passing. So sleep well, comrade, mentor, political father, an outstanding son, St. Lucian son of the Caribbean soil. Next slide. The COVID-19 pandemic not only introduced a public health crisis into societies of the Commonwealth, it was an economic and social shock to states and their institutions. As a result, people at the level of the household endured a transformation of social relations, including the deepening of social inequalities. One of the primary forms of social inequalities was gender inequality. Next slide. The Commonwealth Declaration for Gender Equality and the Empowerment of Women affirms government's commitment to comprehensive and meaningful actions on gender equality and gender-responsive measures to redress pre- and post-COVID-19 development challenges, especially regarding the improvement of the social, political, and economic lives of girls. Persistent gaps, however, related to the advancement of gender equality frameworks and actions in the delivery of youth programs and projects limit the possibility of gender transformation in our societies. Youth programs and projects that are not sensitive to gender and development issues, such as the unequal sexual division of labor in the household, multiple forms of gender-based violence in communities, child sexual abuse, and again, harmful gender beliefs that put youth at risk of things like HIV, effectively underserve young people. Next slide. So policymakers, project developers, and coordinators are specifically youth workers are now confronted with the following questions. How are gender equality policies and frameworks mainstreamed and integrated comprehensively in youth programs and projects? What are the emerging gender and development issues that youth programs and projects must address in today's environment? And in what ways do the experiences of designing and implementing youth programs and projects inform the way we develop gender equality policy and frameworks? Next slide. So in this presentation, I discuss the significance of gender transformative frameworks as an instrument for gender equality in youth work. Then I discuss emerging issues in gender and development, technology facilitated gender-based violence, that's 1, menstrual health and hygiene, 2, and then engaging boys and men for gender equality. Next slide. So I'm representing the Gender Affairs Division in Gender and Child Affairs. We are hosted in the Office of the Prime Minister in Trinidad and Tobago. The division is the national focal point for gender and works to promote gender equity and equality through the process of gender mainstreaming policies, programs, and projects. Next slide. Some of the challenges that we see, we like to get straight into business. We have some development challenges. You see gender mainstreaming is not uniformed in the youth development sector. Some places where we have focal points, we have strong delivery, and in other areas, it's really reliant on the specific attitudes of a youth worker to advance it. And that means it is not uniform. Our next issue is that the commitments to gender equality are in our youth policies, but some workers don't have the capacities to operationalize them. Another one is weak gender analysis and data collection. Regrettably, gender is still understood reductively as sex, and people look at male and female participation rates in order to measure social, economic, and political progress around gender equality. We need to sophisticate our programs, therefore, but we have to begin with sophisticating our data collection and analysis in the state. And then programs do not redress harmful gender beliefs. Oftentimes programs are gender neutral and gender accommodating in light and in spite of the gender commitments in youth policies. Next slide. So we have an imperative. Let's think about what we must introduce moving ahead one time. We need to have gender specialist knowledge and exchange through partnership with state and non-state actors. Civil society has played a fundamental role in ensuring that governments can lead with the correct gender analysis and apply gender equality frameworks with confidence. We need to ensure it's not just a word we could give, but gender mainstreaming provides technical frameworks and capacity building for design, monitoring, and implementation. In our experience, we have seen how templates play an important role because it's very difficult to have additional staffing sometimes. But sometimes we could empower a public worker, a youth worker with a template to guide the mainstreaming work and process. We need to also have sensitization, gender equality guidelines and protocols for youth workers. Programs must apply gender transformative frameworks which redress harmful gender beliefs. And we also, when doing programs, whether it be on issues of climate change and ecological justice, whether it be on sustainable cities and urban planning, or we could go to international relations and geopolitical frameworks for security. We must empower young people in our programs to become advocates for gender equality. Next slide. So what we propose is looking at a gender transformative framework and action. Gender transformative action puts forward a holistic critique and action for change for all people and institutions instead of placing the burden on girls and women to live free from violence. For example, gender-based violence is both a symptom and cause of deeply rooted gender inequalities. Ending gender-based violence therefore requires gender transformative action, which challenges individual attitudes, harmful ideas in societies, and institutional policies and practices. So gender equality is a goal, and working towards that goal necessitates gender transformative action. Next slide. Gender transformation, therefore, it addresses the root causes of gender inequalities and promotes actions for individuals and structural change. Next slide. So let's look at one of the emerging issues that we are trying to confront in Trinidad and Tobago is technology-facilitated gender-based violence. It is any act that is committed, assisted, aggravated, or amplified by the use of information, ICTs, information communication technologies, digital tools, which result in or is likely to have physical, sexual, psychological, social, political, economic harm. And this disproportionately affects women and girls, but young women and men have been victims of technology-facilitated gender-based violence. At the level of the state, this is also a legislative issue and a national security issue. Therefore, gender plays a fundamental role in ensuring that not just the awareness happens in a society, but that there are laws to protect the rights of people and that national security could safeguard people and ensure that we have an effective response. In the Gender Affairs Division, what we did to begin this thinking, especially in the year of CSW 67 on digital technology for gender equality, we hosted a symposium on technology-facilitated gender-based violence and its impact on mental health, which generated over 150 participants, and we brought state and non-state actors to the table to have this virtual symposium and town hall. But we also had something called the Youth Tech Initiative, where we looked at 6 secondary schools to introduce them to careers in STEM, but also highlight the harms around technology-facilitated gender-based violence. And we did that in the Office of the Prime Minister in partnership with the ICT department and what we did at Gender Affairs Division. So this is an emerging issue that sometimes represents all harms in new technologies, gender-based violence, where young people procure a lot of social relationships and experiences online. We need to be sensitive to and have an effective response to at this moment. Next slide. We'd like to look at the issue of menstrual health and hygiene, which is essential to the health, comfort, and well-being of women and girls. An estimated 500 million women and girls lack access to quality menstrual products and sanitation facilities worldwide. Cultural beliefs and norms about women's uncleanliness, quote unquote, their so-called impurity, shame, they reinforce the notion that menstruation is taboo. It justifies the exclusion, mistreatment, and discrimination of women and girls. These beliefs and norms restrict the equal participation of women and girls in households, communities, and public spaces. Now, menstrual health and hygiene is also rooted in women's and girls' access to clean water and waste management, use of sanitary toilets and bathroom facilities, the ability to afford sanitary products. Low-income women and girls are especially vulnerable to the health risks when these things fall short. Period poverty is a term that describes the socioeconomic vulnerability low-income women and girls endure due to this lack of access and resources. Therefore, all of government and society, and youth workers especially, must see the importance of valuing the dignity of women and girls in policy, education campaigns, and the design of spaces. So currently, the Gender Affairs Division, we have been engaging civil society and the private sector around the issue of period poverty. but we are developing an understanding internally around our commitments to menstrual health and hygiene. So we are going to support period poverty advocacy, that's one. And second, support the advocacy for period-friendly spaces in communities and with the youth development sector. Third slide, next slide, sorry. And my third point. Let's look at one of the fundamental challenges facing Trinidad and Tobago. Gender-based violence, yes, it is a global problem. And Trinidad and Tobago is not exempt from this. We know the data that currently 1 in 3 women and girls experience a form of gender-based violence in their lifetime. That's at the global level. It hurts me to know that 44% of ever partnered women experience intimate partner violence in Trinidad and Tobago. And that means we are well above and currently higher than the global average. So the COVID-19 pandemic catalyzed the economy and social sector. One of the realities we had to contend with, as with other countries in the world, was the increase in violence against women and girls, what people refer to as a shadow pandemic, to highlight their vulnerability. And according to PAHO in Trinidad and Tobago, we had a 140% increase in reports about the abuse against women in 2020. So engaging boys and men for gender equality, because we understand their role as a social group and the challenges around masculinity as a driver for violence in the society. We have 3 initiatives to raise awareness with young men at this time. We have the Barbershop Initiative, which is a program implemented for adolescent males in the secondary school between 14 to 16, and we work with them around challenging harmful gender stereotypes, but also giving them a positive self-image as young men to determine how do they see themselves as human, what are quality relationships that they could have to other men, to other women, to communities, and the environment. We also, of course, support the UN Women Foundation's program through the Spotlight Initiative, where we have been training facilitators designed to equip individuals with gender programming with knowledge in Trinidad and Tobago. And so far, we have trained a cohort of people over 8 sessions. We have 31 facilitators coming out of that program. And then we have Project SARA, which is an acronym for Safeguarding and Rescuing All Humans from Trafficking. We implemented this in collaboration with the Ministry of National Security, the Counter-Trafficking Unit, which is to have sensitization, but really improving men's awareness in national security and the public around strategies used by traffickers, the ways of reporting and preventing acts of trafficking, and understanding the gender dynamics of human trafficking. My last slide, which is the next one. So as I close, we have emerging issues in gender and development, which many of you all know already. Technology facilitated gender-based violence, menstrual health and hygiene, and the rights of young women and girls, and then engaging boys and men for gender equality. These are the issues that we are taking on in the Gender Affairs Division and working with government stakeholders and civil society to advance. What that tells us is that we have to design, resource, and implement values for gender equality in youth work. Youth work, the gift of it, is that it exposes us to the lives of young women, girls, young men, and boys that can also animate gender and development. There are generational issues in the work of gender affairs. We want to address that because we see youth as agents for change, as well as if we invest in young people, they model the practices of the future around equality and gender equality. Thank you. That is all.
Thank you, Mr. Sanatan. We have 20 minutes now, so we can take questions, both from Mr. Sanatan, Dr. Gore, who's still online,
Yes.
and also from our speaker in the room. So, do you have any questions?
He was a bit fast, you know, couldn't read all the muscle.
Yes, sure.
It's a very good initiative. I mean, designing a new methodology and approach. But if you can also enlighten us in what way this is unique, because traditional methodological framework also there is scope for innovating methodologies
Right.
depending on the circumstances and the team.
Right.
So I understand the rationale behind that. You need to focus more on gender sensitive
A bit
data
higher.
collection. But in what way this is actually a unique framework?
Right. Right.
What characteristics are there to distinguish it as a
Right.
unique framework?
Right. I agree. Thank you so much. Thank you so much for the question. Suji, I don't know if you could hear that.
Yeah, I can hear the question. Bijita, do you want to answer or you want me to answer?
I can answer. I can take it up. Okay.
Yes. please
And you
do.
can add maybe. I'll start
Yeah,
and you can
yeah.
add. Yeah.
Yes.
Thank you
yes.
so much for the question, first of all. So, what makes it unique? It's a very good question. What my starting point would be is the focus it has on the use of language, sensitivity, the focus it has on keeping things simple, unlike rigorous scientific research. So I'm not by that, I don't mean that this is not rigorous. It is scientific, it is rigorous. But the point here is that you make it as simple as it can be, and in a way that young people can take it up, adapt it, use it within their different contexts, unique contexts. And in Asia, the contexts are very, very different. And I'm sure you know that. So what makes the feminist consultation methodology unique is also how with every step, there are some points about if you're dealing with this issue, how do you do that? What should be your approach for that? If your thematic focus, let's say, is on menstrual hygiene management, as we were hearing, what should be your approach that on around evidence generation? So while we were summing it up here in the 6 iterative steps, it has got a lot more to it. The document has details, it has lots of templates that tries to simplify things at each step as we move on with the consultative process. Suchi?
Yeah, and thanks, Bijita. And just to add to that, there is a lot of focus on how you can use language in a more empowering manner. And when we say language, not just which language you're using, but the kind of terminologies you use, the kind of way that you bring it together around framing and sentence formation and asking questions in a more truly feminist manner rather than just asking very directed questions, not using jargons. So there is the uniqueness of the methodology lies actually in the way the methodology is designed. If you look at the methodology, there are a lot of pointers, there is a lot of guidance that is provided in going back and forth around, hey, I have come up with this question, how do I ask this right, can I frame the change the frame, and going back to community and agreeing. So there's a lot of focus on consultative processes rather than a research team sitting together and doing things.
Yeah. So it's a bit beyond just pure research, the way I would have probably done it at my, master's or MPhil or PhD level, So it goes a little beyond that. Yeah.
I just want to ask the two speakers, especially the first one. You've done a lot of something different from not the normal standard, how do you say, approach to create. So you have actually created your own model.
Yeah.
Am I right to say that? Yeah.
Yes.
And then how do you implement this model when you are actually training other people?
Yes.
And have you also created a manual based on what all the techniques that you have?
Right. Suchi, I think you can take that up better.
Yes.
She wants to, yeah.
Yeah, so please correct me if I've understood it right. There was just some disturbance in the background, but um, there are a lot of ways within how the methodology is designed. If you look at the methodology, it's a 180 page document, and it is being translated in multiple languages. The methodology in itself talks about how to implement it in different ways on the ground. How do you use it? But we had a slide where we had skipped that because of shortage of time, but we mentioned around how this works in complementarity with leadership tools, with safe space tools, with tools that are around program management and design. Because if you go with that approach of training young people or youth groups in kind of disrupting mechanisms, and teach them this as a part of a larger peer exchange or peer learning model, it's truly very beneficial. And I'll give you an example. In South Sudan and in Kenya, for example, we are using this methodology with a set of young women leaders who are working on sexual and gender-based violence on ground. And what they have done is through the training in a very peer-to-peer manner, through the training clubbed with our leadership training model, with our transformative leadership training model, they are now designing the agenda around advocacy in communities, campaigns in communities, and how they will then take it to policy change. And for example, domestic violence change in South Sudan, or in Kenya, talking about role of young women in climate justice. So there is uniqueness in the way how this methodology can be built within the peer-to-peer model in any training program or any youth leadership initiative, and then that manifests in different ways. Because what it does is any skill, this skill becomes replicable into any work they do with the community, and it basically puts in a lot of focus in doing it in an evidence-based manner and not just sake of manner, but not putting the young people out of it, bringing in an expert to do it. They become the expert of driving it and makes it very sustainable. So while we have shared examples from Asia, there have been very good examples in Africa and Middle East also, where the methodology is being adopted. And actually somebody has volunteered recently to do an Arabic translation because they found the methodology so useful, and communities, like for communities. So just sharing those examples. I don't know if I was able to catch your question correctly and answer. If you have anything else to follow up, we can respond.
Yeah, and to add to what Suchi just said, and that was, I think, the second part of your question, we are internally also using it constantly. So to give you an example, we are right now with our program Rise Up Phase 4, we are in year 2 of implementation. Now for the year 3 implementation, we want our team, the cohort of young women we work with very closely, to use FCM to design the next phase of implementation. So it will be the 6-step process, the consultative process that they will use to then design their work plan, to see what are the thematic issues they would want to focus on, how they would do it. So we are also constantly adapting, using it within, the systems we are working with to make sure we want it to challenge us. We want to find it, take up those challenges and see what we can then change to make it better. Because that's the idea.
The reason why I'm asking is whether your methodology could be a useful synergy for Africa. I'm in gender area, and so this is why I'm interested in whether it can be applicable.
The tool is available online.
Yes, it is. Yes. I have the scan code. You can actually take it from me.
Yes,
I have it. I can share it with you.
But sorry, but
I have my own website, which is in construction on gender.
Okay.
This is where I'm interested.
Great.
But if someone wants to be trained using that methodology and how to use the tool as well, but is not like in the communities that you are supporting, can they still have the training through the YMCA?
The YWCA?
Yes, through the WCA.
Yes.
Online or?
You can reach out to us at world office at worldwidewca.org. We'll be happy to do it.
We'll be happy to do that.
Focused in making the tool open source. It's an open source tool. Anybody can use it. Anybody can write proposals with it. It's World YWCA's contribution to making spaces more youth friendly. So we will be happy to include them because we have constant trainings that are going on around the world online and in person. So we'll be happy to fix up something.
Any other questions? No. I have a question. Yeah. The question?
Yeah, please.
No, go ahead. No.
I haven't really phrased this, but I'm excited to ask it. It's more just about specific challenges in your project, because obviously in readdressing gender inequality and empowerment of women and girls, we know that needs to include everyone, so boys and men and wider and age and everyone. And yeah, just like what specific challenges there were in these projects in trying to bring them on board with these changes. Just would be interesting to know more about that angle.
All right. Yeah, you mean about the 2 case studies that I
Yeah,
spoke
yeah,
about within that context?
Yeah.
Okay. Yes, there were several specific challenges, and since there was shortage of time, I couldn't really go through the slides in more detail. But so one example that quickly comes to my mind, in the Rohingya case study from Bangladesh, they wanted to research on a different theme altogether, right? Healthcare access, they wanted to go deeper than just healthcare access.
Yeah.
And through the first 2 stages of deep dive and discussions, these young women, when they designed their research question, they needed some permissions from the camp authorities, because it's a camp, it's a resettlement camp, it's a colony. So there are different protocols that they need to follow. So it was getting extremely difficult and frustrating for them that, they wanted to research on and generate evidence on something that is very, very close to their, daily existence. But they were unable to do that because of the protocol and so they had to tweak the question around. They had to be political, quote unquote, about it. And, that's how they reached out to the healthcare managers, to the camp clinics, the people who were working there. So you see, this experience by itself is so telling. The girls have shared in their stories that how they realize that people want to hush what is to be spoken out loud, or to be talked about. So that was, I think, that just quickly came to my mind when you said what were some of the specific challenges. There have been many in every context, and I'm sure Feminist Munch also has its share of very specific challenges. But the beauty of FCM, again, and I'm going back to that, is that this ability that you be flexible in tweaking your question around, and the templates allow you, they help you, they support you, they facilitate this process of tweaking those questions around, how you can do that. So they were able to still do their evidence-based research. They made that question their sub-question, they hid it within the broad thematic area and brought in other layers. But I think the work was still done, the evidence is still out there. And I was sharing the findings, you would have seen the status, the state of affairs there, the camp clinics is deplorable, it's horrible. And a lot needs to be done. And I was so glad we had Suchi, when was that? We held there was a webinar of.
Yeah, just last week we had. Yeah, last
Yes.
week we had a webinar. Yes.
We had a webinar and we was exchanging all the 4 research findings. There were 4 from all the 4 research representing their countries. And the lady from Bangladesh, she shared that they are going to take these recommendations to the government of Bangladesh. And that was, that is great. I mean, because they feel something needs to be done about it. This is evidence hard, gained from the ground, and something needs to be done about it. Otherwise, it can't just sit there on the ground. So they have their next steps designed, and they are going to follow that up.
And a good example of extended impact is also like the Feminist Munch group is actually taking the evidence to the HLPF, the High Level Political Forum that's happening right now as we speak in US, in New York.
Right.
They're also taking up it to the SDG Summit next in September. And so it's an extended impact, like because it was not just restricted to the CSW piece and that they did that work that time, how they are linking that technology usage and multi-country evidence to different policy spaces is already happening, and we can see that impact of how it's been shaping policy conversations by young people. All these young people who are part of the co-lead group are actually now sitting in those spaces and talking about the evidence using the FCM.
Right. So I think a lot of what we have been discussing in the last 2 days also, to actually have that seat in spaces where policies are being made, that was made possible, has been made possible by the FCM in some way or the, I mean, it's been there. So yeah, feels great.